supposed to do with the biotech stocks here? The whole healthcare cohort has been in the crosshairs in recent months, lately because many of the Democrats running for president are campaigning on Medicare for all. And even the more moderate candidates want to crack down on out-of-control drug prices. I think these worries are overblown. I mean, even Senator Elizabeth Warren says she's open to multiple paths on health care. When you hear Medicare for all, think Medicare for more. And if that's the case, there might be some real opportunities here. You might want to take a look at some of the smaller biotech players, like Emergent Biosolutions. Here's a company that makes vaccines, including the only FDA-approved anthrax vaccine, as well as products like Narcan nasal spray. You've probably heard of that. It's what you give people when they overdose on opioids. Just yesterday, Emergent won a major contract with the Department of Health and Human Services for a compound that treats complications from the smallpox vaccine. It's part of a stockpile. Hopefully, we never need it. When the stock zoomed on the news, Emergent has been having a tough year, okay? So it's really kind of an interesting moment. Some of that's because last year they bought Adept Pharma for the Narcan business, and Teva recently got approval for a generic version of the same thing. So could the stock be ready to run? Let's dig deeper with Robert Kramer, no relation, the president and CEO of Emergent Biosolutions, to get a better read on his company and its prospects. Mr. Kramer, welcome to Mad Money. Good to see you, sir. Have a seat.
Pleasure to meet you, Jim.
All
Thank
right,
you.
so let's go right into it. That's a gigantic contract about smallpox. When I first heard about it, I said to myself, we're all inoculated with smallpox. I can still see the vaccine. Why do we need to spend $600 million on smallpox? But apparently, there's some real issues with smallpox that we do need to be immune against, right?
Sure. So smallpox is one of the biologic threats that many countries, including the United States, is most concerned about from a weapon. So our country stockpiles both therapeutics as well as vaccines to protect our civilians and military populations from the threat of smallpox. So the contract that you mentioned yesterday that we announced was for the therapeutic piece of our smallpox franchise. We also have a smallpox vaccine that we're in contract negotiations with the U.S. government as well that we expect to complete in the coming months.
And it's not just that terrible disease, typhoid, cholera. These are all right in your wheelhouse, right? I mean, you must have some special expertise in this stuff.
Well, they are. So our company was formed in 1998 around public health threats in general. So our focus is on protecting life and ensuring that these public health threats are dealt with effectively. So we have partnered for more than 20 years with the U.S. government as well as foreign governments to come up with durable, long-term solutions to prepare for and protect against these chemical and biologic threats, as well as travelers' vaccines like typhoid and cholera,
right.
And then more recently the opioid crisis.
Okay, let's talk about the opioid crisis. I think Narcan's amazing. You have a nasal spray schools program, but you do have Teva, and Teva's been known for ruining other people's margins. Can you still make money on Narcan with Teva in there?
So we can. I mean, obviously, when we did the diligence on the Narcan nasal spray product last year, we thoroughly looked at the competition, the markets, both who were in there and as well as potential competition. We got comfortable with the patent protection of the product, but most importantly, beyond that, I mean, we're focused as a company on making sure that Narcan nasal spray is made available and made affordable and accessible to the 34 million patients who CDC has determined are at risk of an opioid overdose.
I know you've got this great program. Each state department of education or individual school can prepare high schools, colleges, and universities across the country for an opioid overdose emergency by stocking Narcan nasal spray. What a great idea. But are these schools doing anything? Once someone's been saved by Narcan, are they recidivists, or can you teach them or help them or really just kind of give them some sort of therapy that they won't be in trouble again?
Well, I think that's part of the whole comprehensive solution to the opioid crisis is it's not just coming up with medical countermeasures like Narcan nasal spray, but it's awareness, it's education to make sure that this recidivism doesn't happen again.
Yeah, because it really is it is the nationwide epidemic.
It is.
Now, I want to ask you about a couple of these that you're working on. It does say you've got a seasonal flu in phase 3. A lot of people caught the flu and took the shot. Is yours going to be more powerful?
So ours is a therapeutic. It's a flu IG product, so it's not a vaccine. It's a therapeutic product for rescue therapy. So when you present serious symptoms in the hospital and it's too late to immunize, then you take our therapeutic
Do
flu
we have
product.
to do it just in the hospital? What happens if we catch really bad flu and we're at home?
Then you take a pre-therapeutic or a vaccine.
Okay. Now, how about Zika, which I thought was wiped out? Was I wrong about that?
Well, Zika is still a potential threat. So we work across a number of pipeline products that we have in development for many infectious diseases, as well as chemical and biologic threats. So as you indicated, we do a lot of work in the area of anthrax and smallpox and botulism. And continue to look at travelers' vaccines for typhoid, as well as cholera.
And you can make money on these, because I see you're trying to do something in Ebola. My concern would be that as public health, you have to give it away.
So we don't have to give it away. I mean, our approach is a little different from a typical pharmaceutical company. We typically like to contract with customers for long-term procurement contracts, so 5 to 10 years in duration. And when we come up with a fair and reasonable price for that 10-year period, it gives the customer the assurance of what they're going to have to pay for the product, but it also gives us the capital to invest long-term in infrastructure and capability so we can be that durable, reliable partner to governments, foreign and domestic, to make sure that these countermeasures are available.
Well, one last question, Mr. Kramer. I mean, I feel scared. And you don't mean to scare me. I mean, maybe it's because I'm watching that Chernobyl thing. I can't see the disease. But, I mean, smallpox, these are terrible illnesses. And there are bad countries out there. Is this something we should worry about?
Well, I think our country in particular is doing everything they should to make sure that we are prepared and to protect civilians and military populations from bad people doing bad things.
Well, I feel better. I know that you're working on it hard. I understand that you can make some money too. So it's a good thing that you're doing, and maybe the shareholders can make some money too.
Well, I think they will, and a lot of credit, Jim, goes to our 1,600 employees who wake up every day looking for an opportunity to make a difference.
Well, excellent. Thank you so much to Robert Kramer, President and CEO of Emergent Biosolutions. Wow, they do some pretty amazing things. I want to thank you so much. Mad Money's back after the break. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.